What are the deadliest diseases and what is it like to die from them? Today we're talking about end-stage liver disease. So I've seen hundreds of people die, and from what I've seen, the more you know, the more you're prepared, the better you will live and the more peaceful you will die. So I have found that education about your specific disease or your loved one's specific disease will help you prepare, help you understand, help you decrease your fear about the disease, and help you advocate for yourself or your loved one during this disease process. Also, the more you know, the more you learn about this disease, the better symptom management you can have, which again, the better you will live, and then the more peaceful you will die. End-stage liver disease. First off, how does this happen? In general, on hospice, specifically for hospice, I'm talking about end-stage liver disease from either alcoholism, non-alcoholic liver disease, which does exist and does happen, and then any kind of cancer that's either liver cancer or metastatic cancer to the liver, meaning your cancer was somewhere else and then it spread to the liver and became end-stage. These are the main symptoms of liver disease while on hospice. I specifically say while on hospice because you can live a life with liver disease not on hospice. So just so you know, this is specifically for hospice patients. The first thing you will notice is jaundice. Jaundice is a yellowing tint to the skin, which you may or may not notice. Sometimes it can be harder to notice, especially on darker skin. Where you will really see it is on the sclera of the eye, so the white part of the eye. This is just something that you will visually see on yourself if you have liver disease, or on your loved one or your friend who has liver disease. It doesn't actually cause any pain or harm. It's just something you will notice. The only thing it may do is cause some itching. And of course, if you notice this on yourself or your friends or loved ones, do not self-diagnose yourself. Of course, go see a doctor. And just because someone may have jaundice or some kind of yellowing tint to their skin or to their eyes does not necessarily mean they have end-stage liver disease. This can mean a plethora of things, but what I'm specifically talking about today is end-stage liver disease on hospice. You will be jaundice. So the main thing you usually see with end-stage liver disease on hospice is something we call ascites. Ascites is fluid in the abdomen. This is massive. I mean, a lot of fluid. The person, male or female, will have fluid in their abdomen built up so much they will look 8 or 9 months pregnant. This is something that happens to everyone. It will need drained for symptom management because, as you can expect, it can hurt and it can cause shortness of breath because it's pushing on the diaphragm. So if I see someone coming on hospice with a lot of ascites, I will always recommend them first not coming on hospice, going to their doctor and getting a drain placed. It's called a pleuric. That's a permanent drain placed in your abdomen. So when you come on hospice, we can drain that ascites in the home. If you're not on hospice, they usually have you go in every month or every 2 months to have that ascites drained while you're having a procedure. While you're on hospice, I would always recommend the drain being placed before you come on hospice so we can manage your symptoms in the home. So the early signs of ascites is you'll slowly see your abdomen growing. People don't know this is happening, so they think they're bloated or they ate too much. It will slowly grow kind of like a pregnant belly. Now, obviously faster than 8 or 9 months, but you will notice it slowly growing. So it's not necessarily always 8 or 9 months pregnant looking. It'll slowly start. So once you start seeing that, again, speak to your doctor. Speak to your doctor if you're noticing this. Again, I'm specifically talking about hospice patients here who are already on hospice or who are coming onto hospice. They will have already been seeing this ascites for months prior to coming onto hospice. So the third symptom is confusion. Anyone with end-stage liver disease on hospice will have confusion. It's inevitable. And why does this happen? It happens because ammonia levels rise, and this causes a person to be confused. We do have something to help with that. It's a drug called lactulose. It's a sweet thing you drink, and when you drink this, it binds to the ammonia and then you poop it out. So side effect of the medication, you do have a lot of bowel movements, but it will clear that ammonia so you can be less confused. At the end of life, very, very end of life, when someone's actively dying or getting closer to death with liver disease, it'll be pretty hard. They will still be confused whether you give lactulose or not. But prior to that, lactulose does a great job at helping with that confusion. So end-stage liver disease on hospice, like I said, can happen for many reasons. It could happen because of cancer, you have liver cancer, or it's metastatic, meaning it's spread to your liver, or from alcoholism. So if someone comes on to hospice for end-stage liver disease because of alcoholism, which happens all the time, a lot of family members want their loved one to stop drinking. They can't believe their loved one's still going to drink, even though they're dying from this disease. On hospice, we are not here to make someone stop drinking, as crazy as that sounds. As long as someone is safe, we will allow them to continue to do what they've been doing. Now, if you're in end-stage liver disease and on hospice for alcoholism, you're gonna be pretty debilitated. So it's going to be hard to continue to do the things you may have been doing anyway. So they may not have this life they were leading before, but if they do on alcohol, we will allow it, especially if they're going to be safe in their home, in the bed, wherever. We will allow them to continue to drink. It is not our job to force them to stop. You know, we can always educate, and if they want to stop, of course. But this is the time where we are focused, again, more on comfort. Again, this is end stage liver disease on hospice. People with alcoholism can have their liver be affected and then stop drinking, and their liver gets better. So I'm not talking about those people. I am talking about people specifically who are already end of life liver disease and on hospice. We will be more comfort focused, and as long as they are safe, we are gonna let them do what they want. The main thing I wanna drive home about this topic is that hospice can help you manage the symptoms you're going to have from this disease. I think it is so important for people to understand that when they're coming onto hospice with the symptoms from liver disease, like ascites, that fluid that's building up in their stomach, there is something they can do for that, so they can be comfortable in the home. And like I said, it's that drain that can be placed before coming on hospice, that they can have placed, so when they come on hospice, we can drain that fluid whenever we want to, and that will help with their symptom management at home. And of course, you can't take my word for it. This is me just educating in a general way. Not everyone can get that drain. It all depends on what's going on in your body. So always talk to your doctor, always ask questions, always advocate for yourself. These videos are just generalized information, so you can take this information and then go talk to your healthcare providers. Again, so in general, with liver disease, the things you will see is the jaundice, which is the yellow tint to the skin and eyes, the ascites, the fluid buildup, and the confusion, and then sometimes pain. So all of those symptoms are typical and normal to see at end-stage liver disease, and all things that hospice can manage. So you will not necessarily die this horrific death because you have this disease, because you're on hospice, and we can help manage those symptoms. All of these things are important for you to know, so you don't have to be so afraid or feel so afraid, so you can live better and die better. So knowing this information and knowing what to expect allows you to better prepare and plan for your future. Let me know what questions you have in the comments, what disease you'd like me to do next, and don't forget to subscribe for more death and dying information.